affecting countries' abilities to get access to test kits. We understand there is a global shortage of reagents, but we are also hearing from some countries in the region they cannot get test kits out of the United States. Dr. Aldigueri?
Thank you, Sebastian, and thank you for the journalist for this question. The ABOST test mentioned is not a rapid test stricto sensu. This is a molecular test working very fast. At the moment, this test is available in the US on the US market only. But in this context, PAO is supporting different pillars of the laboratory response in the Americas. The first pillar is to keep supporting more than 30 national laboratories and networks with kits to run their PCR machine. It means more molecular technique. We have provided during the first month countries, these 30 laboratories, with more than 200,000 tests, and we are in the process to ship more than 1.77 million tests at the moment. The second pillar is to work with the providers to access COVID-19 reagents for running their automated machines that are already doing TB, HIV, and other pathogens in their hospital and clinics. And finally, the third pillar of the PAO laboratory response is to work closely with National Institutes of Health and national regulation agencies regarding the field testing of a new non-molecular rapid test emerging every week on the market. Regarding some shortage and some difficulties in accessing some kits, PAO is working with more than 2 months with providers in the US and in Germany that are not affected by new regulations. PAO, as I said, is providing national reference laboratories with an increased number of tests from these providers. Please note that so far, PAO was able to train, equip laboratories in more than 30 countries in the Caribbean, in Central America, and in South America. Thank you.
Thank you, Dr. Aldigueri. Next question comes from El Universal de México. Y la pregunta es, en medio de una emergencia como la COVID-19, ¿está la OPS-OMS preocupada por el número de trabajadores de la salud disponibles en México? Y si la OPS tiene estándares de la cantidad de médicos y enfermeras necesarias que tiene que tener un país para responder a una pandemia. Doctor Barbosa.
Gracias por la pregunta. Es seguro que esa pregunta está relacionada con el informe mundial que la Organización Mundial de Salud lanzó hoy. Hoy es el Día Mundial de la Salud. Y el tema del informe es la situación de la enfermería en el mundo. Y aprovecho para enviar un saludo y un fuerte abrazo para todos los profesionales que están ahí en la línea de frente. Mire, en todos los países, seguro que el COVID-19 está a exigir de las autoridades nacionales que hagan esfuerzos adicionales para se preparar para un escenario donde la transmisión rápida puede sobrecargar los servicios de salud. En México, por ejemplo, a Secretaria de Salud está em um processo de recrutamento de profissionais com a meta de ter 20.000 novos profissionais participando de los sistemas de saúde. Isto seguro que vai agregar mais personal para responder. Em outros países da região, há iniciativas semelhantes. Nossa recomendação é que, com base em los modelos que se pode tomar para a planificação, verificar se há necessidade de uma boa coordenação entre todos os sistemas de saúde de um país, o público, o privado, o de seguro social, recrutar a novos profissionais para que os sistemas de saúde tenham capacidade de atender a las pessoas. Gracias.
Gracias, Dr. Barbosa. Next questions come from Barbara Fraser from The Lancet. As COVID-19 cases increase in part of the Amazon basin, what recommendations do you have for management of cases among indigenous people, especially those in remote communities, and for ensuring that groups living in voluntary isolation do not become infected? Dr. Aldiguieri?
Thank you, Sebastian, and thank you to the person from the Lancet. PAO is aware of the first reports of COVID-19 among indigenous communities in the Amazon basin. The same concern applies to indigenous people of the Altiplano in South America and also other communities in Central America and the Caribbean. We have developed and shared with member states guidelines regarding this recommendation for dealing with indigenous communities. The first important aspect of the approach specific to indigenous communities is a risk communication package adapted to specific ethnic groups and their languages, taking into consideration their specific culture, what the disease represents, what the risk, the notion of risk represent. Regarding infection prevention and control in indigenous communities, I would say that the same guidelines that we use for long-term facilities involving senior citizens would apply in many aspects. It means reducing a lot visitors from the exterior, from outside the community. And when these visits are mandatory, use as a go-between healthcare workers, which are trained and equipped and medically checked before they enter the communities. And also, when contacts are really mandatory, really ensure that they are minimal and outsiders equipped with the gears for prevention and control. One important aspect for maintaining prevention activities in these communities is also ensuring that the food security aspect is covered by the local government. Communities that want to remain autonomous should have access to supply chain in terms of food. Thank you.
Thank you, Dr. Aldiguieri. We just want to remind you that we are going to do this briefing until 11:45, so you can make questions through the chat by now. Les recordamos que vamos a hacer el briefing hasta las 11:45, unos 15 minutos más, así que pueden seguir enviando sus preguntas por el chat. And we have from the chat, we have a question from Dylan DeShong from Loop Caribbean News in Trinidad and Tobago, and very similar questions from Elga Velasco from Unitel Bolivia regarding the use of masks. Elga says, se ha recomendado en varios países donde el contagio ya es comunitario sostenido el uso constante del barbijo a la población para disminuir la propagación del virus. ¿Qué recomienda la OPS en este momento de la pandemia acerca del uso del barbijo? Y Dylan DeShong, he also says that governments across the Caribbean have asked citizens to use masks, particularly cloth masks. What is PAHO guidelines for masks? What type of mask should citizens use when venturing outdoors? Dr. Barbosa.
Gracias por la pregunta. Esta es una pregunta que tiene hoy una recomendación de la OPS y de la OMS, que es la misma. Primero, que las máscaras cirúrgicas se deben preservar para los profesionales de salud. Cuando se hace uma recomendação para a população, é importante, primeiro, revisar se há evidências científicas que estão a apoiar essa recomendação. Segundo, é importante verificar se essa recomendação é factível para a aplicação em la população. Então, quais são hoje as recomendações para o uso de máscaras? As máscaras cirúrgicas e as máscaras especiais, que chamamos N95, isso se deve preservar para profissionais de saúde. As pessoas que estão com sintomas também devem utilizar mascarilhas, además de outros cuidados, como se aislar, estar com o monitoreio de sua saúde. As pessoas que estão apoiando a uma pessoa enferma também devem utilizar mascarilhas. Há muitos países que estão recomendando o uso de máscaras de fabricação caseira, com paños, com telas. Todavia, não há uma evidência sobre se isto vai ter um rol importante em la transmissão do vírus. Quando isso se hace essa recomendação, há que ter o cuidado de dizer à pessoa que isso não é uma bala mágica ou uma bala de prata, que todos os outros cuidados de lavar bem as mãos, de não estar cerca a grupo de pessoas, de evitar contato, se é possível, de proteger de maneira adequada a tosse e o estornudo, todo isso segue o mesmo. É importante fazer essa recomendação para que as pessoas não creem que utilizando uma mascarilha de paño de fabricação caseira, aí estão já completamente protegidas e não necessitam tomar todas as outras medidas. Muchas gracias.
Muy bien, gracias. Gracias, Dr. Barbosa. Next question from the Caribbean also. It has to do, is from Look Caribbean News, but also Barbados Today. They are asking if PAHO can tell the figures for the Caribbean, and has there been many cases of community spread in the Caribbean region? And also Marlon Maiden from Barbados Today, she's asking about the situation in Barbados and what PAHO thinks about the measures being taken in the country at each stage. Dr. Ugarte or any of the experts?
Thank you so much. Well, first to clarify that there is no community transmission in the Caribbean, according to WHO standards. Still, there are some imported cases, in some cases or in some areas also there are local cases. I'm referring to the Caribbean countries, most of the Caribbean countries. We do have Dominican Republic, Puerto Rico, and other areas where we do have community transmission. And in that regards, we would like to highlight that specifically in Barbados have been establishing and strengthening their capacity to help other countries. Barbados has established the emergency medical team, and it is something that we'll look at to strengthen in terms of having that capacity also at the service of other countries in the Caribbean. And I think that is a good approach, but also it shows the solidarity that the Caribbean has always shown to the region. As a matter of fact, the emergency regional team that is well established in the Americas, which has most participants from the member states, were established first in the Caribbean. So we're looking for the Caribbean for this epidemic, but also we have to highlight that those countries also face several challenges, particularly in the access to personal protective equipment, on tests. And also, we would like to highlight that in this situation, we are following very closely at the highest level of those countries to help them during this epidemic. Over.
Thank you, Dr. Ugarte. One more question from the chat. It's more or less the same question we have from Narissa Fraser from the Trinidad and Tobago Newsday, and also from Richard Kahn from The Guardian from Trinidad and Tobago. They want to know PAHO's recommendations for countries about releasing names of the patient, like where does PAHO draw the line between a patient's right to confidentiality versus the public's right to know what's happening in this unprecedented time? Dr. Barbosa, Ugarte, who would like to take this one?
Yes, thank you. Thank you for this question, Richard. Every country has its own laws and regulations about that, but I do believe that it's common that the privacy is a right, so we cannot oppose the public health measures in the right of privacy. The countries need to report to their population the number of cases, the number of deaths in a very transparent way. This is the best way to build a very strong confidence among the population, and also to show the population that the Ministry of Health are taking very seriously the pandemic COVID-19. But at the same time, we need to avoid any kind of threat that can be posed to a person that is identified in a community. We had this kind of very sad things when HIV/AIDS started in the 1980s, so we cannot repeat that. The best way to protect our communities is to show solidarity, is to support each one, our family, our neighbors, our community, and for the governments to express transparency and to communicate in a very clear way to their population. Thank you.
Thank you.
I add something to this, Sebastian.
Oh.
I think it is important to note that, particularly in the Caribbean, that there is aggressive contact tracing as well. So they may not tell you who the case is, but from that index case, we seek the names of all of the persons that they have known to have come into contact with over the last 2 weeks. And the country will contact these individuals and give them instructions and, if possible, to offer them a test. So even if you're not told the name, the country is conducting contact tracing.
Thank you, Dr. Etienne. We have another question from email from Sputnik. De la agencia Sputnik preguntan en Venezuela, ¿qué gestión ha realizado OPS en Venezuela? ¿OPS ha hecho alguna entrega al país de test de pruebas o equipos y cuántos? Doctor Ugarte.
Sí, muchas gracias. Venezuela ha recibido cooperación técnica no solo a raíz de COVID-19. Tenemos una presencia muy grande allá en Venezuela. Como ustedes saben, se pudo contener el sarampión allá en Venezuela gracias al esfuerzo de muchísimos actores. En el caso del COVID específicamente, hay una cooperación técnica para la elaboración del Plan Nacional del COVID-19. Se han facilitado documentos técnicos de OPS como guías metodológicas, incluyendo la traducción al español de varias guías y ajustadas al país. También se ha hecho capacitación en el manejo de casos, en el diagnóstico de COVID específicamente se envió un experto para poder hacer el entrenamiento de laboratorio para diagnóstico de COVID. Se entregaron test de laboratorio y también equipo de protección personal. Se ha trabajado también en comunicación de riesgo y hay visitas de asesoría en muchos aspectos de la respuesta en Venezuela. Podemos decir que hemos apoyado a 33 hospitales, se han distribuido 350 kits de equipo de protección personal que incluyen para atención de 5 pacientes por 10 días cada uno. Se han entregado 15.000 mascarillas, por ejemplo, batas y guantes de protección. Se entregaron 500 kits originalmente para determinación digamos, de laboratorio, pero se entregaron adicionales, otros envíos adicionales a Venezuela. Y se han entregado materiales también para viajeros. Hay un tema importante en el trabajo con Venezuela. Es que es un trabajo de largo alcance. Hay prioridades en muchísimos aspectos y es necesario identificar, mencionar que este trabajo se hace con muchos actores. Y este trabajo con muchos actores posibilita que se pueda dar una respuesta priorizada en aquellos lugares donde podemos hacer la diferencia. Gracias.
Gracias, Dr. Ugarte. Dr. Barbosa, we're going to ask you if you can answer in English the questions for the journalists in the Caribbean about the use of masks, particularly cloth masks, and PAHO WHO guidelines about this.
Okay, thank you. We had two questions from the same subject, one from a Spanish newspaper and another from an English. So I said that the PAHO and WHO have the same guidance. At this moment, when we adopt a recommendation, we need to look for the science behind this recommendation and also the feasibility of this recommendation. So it is very important, first, to save the surgical masks and the respirators N95 to be used by health professionals. They are in the front line, they need to be protected. Secondly, in some countries, they are recommending the use of homemade masks made with cloths. We don't have strong scientific evidence that this will play an important role to reduce the velocity of the transmission. Maybe in a couple of weeks, with many countries make this kind of recommendation, we will have studies, we will have research to show that this can play a role. But when the countries are making this recommendation, it's important also to tell the population that this is not a silver bullet that will protect them to have the COVID-19 infection. They need to keep all the other measures, washing their hands, protecting their cough and sneeze, avoiding close contact with other people. So first, surgical masks, the priority is to reserve them to health professionals. Homemade masks can play a role in certain settings, such as slums. When you are in a public transportation, we don't have enough scientific evidence. But if you are adopting them, don't forget all the other measures that for them, we are 100% sure that they will help to protect you against COVID-19 transmission. Thank you.
Thank you, Dr. Barbosa. We are getting to the end of this briefing. Ya estamos llegando al final de esta sesión. So we're going to make the last question. Vamos a hacer la última pregunta. The last questions come from BBC. The question is, following the evolution of the pandemic in Asia and Europe, what would be the forecast for Latin America? How is the pandemic behaving in relation to these countries in the region? And when will the peak of infections occur? Dr. Etienne?
So let me thank you for this question. Forecasting is difficult. It's difficult in a situation that every country has its unique set of factors, and our region has many factors that are different from the factors that are present in Asia and even in Europe. However, within the assessments that we've been able and analysis that we've been able to make, we do believe that in the next months or so, 3 to 6 weeks, that many of our countries will begin to see an increase in their number of cases. There are some of our countries that will probably experience an overwhelming of their health systems, and we would probably also see increased number of deaths. Of course, all of this depends on how well our member states execute the social distancing. If they're going to continue with social distancing methodologies, whether we have sufficient workers, whether we have sufficient beds, particularly ICU beds, to manage critically ill patients, and whether we have something as basic as ventilators and PPEs. So the scenario tends to be different, and even within the Americas, the scenario can be different from country to country. In our region, we do have weak health systems, some countries with weak health systems. We do have countries with fragmented and segmented healthcare workers, health systems, sorry. And it is, how do we, in solidarity within countries and between countries, begin to share resources, to share experiences, so that we as a region can come out of this pandemic in as well a way that we can. So we are continuing to work with our member states, recognizing that we are about to face the thunder, so to speak, and ensuring that we can have access to the necessary resources that our member states need, strengthening what's happening at the country level. We have already gone through with them the assessment of what their needs will be, a rough assessment, making sure that those gaps are met and ensuring that the resolve is high to face this, this pandemic. Permit me to say that our heads of states are fully engaged in this response for the greater part. And we continue to work with all of the government for this response. Thank you so much for all of those who've joined us, and we can continue to bear with us, and that we continue to ensure the eye for equity and solidarity. So we thank you when you ask questions that impinge on equity and solidarity. Thank you so much.
Thank you very much, Dr. Etienne. I'm afraid that our time is up. Any further questions, please, you can send them to mediateam@pajo.org and we will answer them as soon as possible. Hemos llegado al fin de la sesión. Cualquier otra pregunta pueden enviárnosla a mediateam@pajo.org y allí les contestaremos lo antes posible. Thank you very much, everyone. Stay safe and healthy. Muchas gracias a todos y saludos.
Saludos.